So, good morning, students. Once again, we will continue with the pathophysiology. So, we have seen that mainly three types of shocks are there. And uh, regarding the pathophysiology, before explaining this pathophysiology, what happens in our circulatory system is usually circulatory system is transporting oxygen and metabolic substrates to body tissues. So, in circulatory system, the blood is carrying different components like oxygen and other nutrients to different body tissues. So, when carbon dioxide and distribution to carbon dioxide, oxygen, and other distribution to various body tissues changing rapidly, in response to this change, like alteration in circulation, in response to that, some intrinsic and extrinsic control mechanisms will be initiated. So this point also you have to write in the notes, that is when the distribution like oxygen, nutrient, carbon dioxide, this distribution uptake is disturbed, there will be some intrinsic like myocardial and intravascular mechanism and extrinsic, that is neuronal control mechanisms will be initiated. So this will be leading to the pathophysiological changes of shock. Hope you clear. So when there is a circulatory failure or response, some alteration is happening. In response to that, our body response is initiated by a intrinsic or extrinsic control mechanism. Intrinsic mechanism is by myocardial and intravascular control mechanism, and the extrinsic is neuronal control mechanism. So we will discuss that mechanism and how it is acting on our body. When there is no blood, that is decreased blood volume, so distribution or failure is happening, circulatory failure is happening, then there is some amount of blood loss or blood volume is decreased or distributed abnormally in three type of shock. Whatever the reason, decreased blood volume will be there. This leads to diminished venous return to heart. When there is no blood, diminished venous return to the heart will be happening, especially in distributive and cardiogenic shock. We can see that then, and hypovolemia also. In that situation, there will be low central venous pressure, low cardiac output, and hypotension will be occurring. As a result of that, vasomotor center, that is intravascular control mechanism like vasomotor centers will be activated. So in different parts of the vessels, there is a vasomotor centers are there which will be activated when there is alteration in the blood pressure and the force of blood. So that will be activated. Okay, that is a vasomotor centers will be activated. So this will cause increase in force and rate of cardiac contraction and constriction of arterioles and veins. So that is what we have discussed, intrinsic mechanism. Myocardial and the intravascular intrinsic mechanisms are initiated. That is as a result of vasomotor center activation. Increase in force and rate of cardiac contraction and constriction of arterioles and veins. Okay. So on the other hand, decreased blood volume, again it will cause release of catecholamines, antidiuretic hormones, adrenocorticoids and aldosterones. So this two-sided effects on our body, like one side vasomotor center activation and another side, because of this blood volume decrease, there will be release of catecholamines, ADH, adrenocorticoids and the aldosterone. So there will be, as a result of these two sides, intrinsic mechanism and the catecholamine and other release, increasing peripheral vascular resistance will be occurring. Increasing peripheral vascular resistance. So as a result of this increasing peripheral vascular resistance, what happens is there will be prolonged vasoconstriction, especially in the extremities, gastrointestinal system, and other area, in order to divert blood from periphery to vital organs. So there will be prolonged vasoconstriction. This will cause fatigue and atony of peripheral arterioles. So കുറേ നേരത്തേക്ക് കൺസ്ട്രിക്റ്റ് ചെയ്ത് കഴിയുമ്പോൾ എന്ത് സംഭവിക്കും? ഫറ്റീഗ് ആവും. ഫറ്റീഗ് ആൻഡ് atony of the peripheral arterioles will be occurring. So as a result of that, ഞെക്കി പിടിച്ചത് എന്ത് ചെയ്യും? ഒറ്റ റിലീസ്, that is vasodilatation. Vasodilatation will be occurring. Massive pooling of blood will be occurring in the peripheries, leads to depletion of blood volume. സോ ഇതുവരെ ഞെക്കി പിടിച്ചത് ഒറ്റ ലൂസാക്കി, അപ്പോൾ അവിടെ എല്ലാം ബ്ലഡ് കെട്ടിക്കിടക്കുന്നു. അപ്പോൾ എന്ത് സംഭവിക്കും? ബ്ലഡ് വോളിയം അവൈലബിൾ ടു കം ബാക്ക് ടു ദ ഹാർട്ട് എഗെയിൻ ഇറ്റ് ഇസ് ഡിക്രീസിങ്. സോ ഡിപ്ലീഷൻ ഓൾറെഡി നമുക്ക് ബ്ലഡ് വോളിയം കുറഞ്ഞിരിക്കുകയായിരുന്നു. ഇപ്പോൾ എന്ത് സംഭവിക്കും? എഗെയിൻ ഇറ്റ് വിൽ ബി ഡിക്രീസിങ് ഫർദർ. That is on one side. On the second side, that is increasing peripheral vascular resistance, there will be hypoperfusion. എവിടെയൊക്കെ ഹൈപ്പോപെർഫ്യൂഷൻ ഉണ്ടാവുന്നത്? റെഡ്യൂസ്ഡ് ബ്ലഡ് ഫ്ലോ സ്കിൻ, കിഡ്നി, മസിൽ ആൻഡ് വിസറ. സോ പെരിഫറിയിൽ നിന്ന് നമ്മൾ ഹൈപ്പോപെർഫ്യൂഷൻ ചെയ്ത് പല ഭാഗത്തേക്ക് വൈറ്റൽ ഓർഗൻസിലേക്ക് ട്രൈ ചെയ്യുന്നതിൻ്റെ ഒപ്പം റെഡ്യൂസ്ഡ് ബ്ലഡ് ഫ്ലോ ടു സ്കിൻ, കിഡ്നി, മസിൽസ് ആൻഡ് വിസറ occurs. So as a result of that, there will be shunting of blood to brain and heart. That we are trying to shunt the blood to the brain and heart. So what happens is, in the skin will become cold, clammy, poor capillary filling, GFR will be reducing, and the kidney functioning will be altered. So this is the second side. Again, because of this hypoperfusion, what happens is oxygen depleted in the tissue cells like kidney, skin, muscles, viscera, GIT. These all cells will get hypoperfused and it leads to decreased oxygen in different tissue cells. So anaerobic metabolism will be initiated, leads to lactic acidosis, and in order to remove this extra acidic nature, the person will be trying to make more carbonic acid and it will be depleted into carbon dioxide and water. So in order to expel this carbon dioxide, what will happen is increased respiratory rate. So lactic acidosis, what we are trying to is buffering mechanism will be initiated and we will be trying to make the weak carbonic acid. So carbonic acid has a peculiar feature of disintegrating easily into carbon dioxide and water. So when more carbon dioxide is produced in our body try to expel this by increasing the respiratory rate. So the person will be breathing more. So that is about the lactic acidosis. Hope you understood the main problem in this pathophysiological changes is decreased blood volume, and there will be increasing the stimulation of the vasomotor centers and catecholamines, ADH and other things will be produced, and there will be peripheral vascular resistance will be increasing. So one side there will be leading to volume depletion, another side it leads to hypoperfusion of the extremities and other body organs, and there will be organ failure on that part. And again in respiratory system also some changes are occurring because of the anaerobic metabolism which is initiated by the hypoperfusion of the cells. So this is about the pathophysiological changes which can be seen in shock. So next we can see the complications. Some of the points are already clear with pathophysiology. Still cerebral edema can be the cortical infarction if there is decreased perfusion, intraventricular hemorrhage can be the renal ischemia will be the respiratory distress syndrome, GI bleeding and perforation. So hypoglycemia, hypocalcemia, electrolyte imbalances. So these are the some of the complications according to the system involvement or according to the tissue perfusion, affected decrease in perfusion. So hope you understood pathophysiology. We'll continue in the next video.